Hey, today's guest is Jaden. He is a trained physiotherapist and he works as a part of a team of physiotherapists to help patients with a range of pathological conditions ranging from cancer to musculoskeletal conditions to cardiovascular problems. He's also a regular speaker for corporations, helping them to improve their working ergonomics even now during the circuit breaker. So thank you for joining me today. How are things going?
Thank you for having me, Dr. Shaan. Yes, thank you. I've been good. How about yourself?
No, it's not too bad, It's a shame to not be able to with patients, but hopefully it's for the greater good and something that's really going to help things here in Singapore.
Yeah, thank you for having me. So right now, I'm at home as well. So I'm with two of my kids. My wife is doing essential service, so I'm, right now tasked with the role of taking care of children. So maybe later on they may join us if they start running around.
More than welcome. So for those people who are watching who maybe have never seen a physiotherapist, how would you describe physiotherapy to them?
So physiotherapy is also known as physical therapy. Broadly speaking, it is therapy for physical problems arising from injuries. It could also arise from disabilities or illnesses. The main goal is to help our clients move better and return to optimal physical performance. For example, for somebody with back pain or neck pain, sports injuries, physical therapy can help by using exercises, manual therapy, or certain equipment such as sports taping to help them to improve their condition. For somebody with a chronic disease such as Parkinson's disease, such as heart disease, cancer, a physiotherapist may use exercise to improve his strength and stamina.
Okay. And so let me ask you, if we start in the very beginning, how did you become a physiotherapist? How did you decide you wanted to be a physiotherapist?
Well, it all began when I was in my junior college track and field team. We were training for a competition and I was starting to have knee pain. Back then, being a school sports representative, we were entitled to highly subsidized treatment in the Singapore Sports Council. That meant that we got to work with specialists and physiotherapists who work with the national team players. And I was inspired by my physio in the Singapore Sports Council. She was very stern. She asked, "Are you sure you're in the right sport?" Being a runner was not just about running for miles. I think what she was trying to say is that we need to be in the gym working on our strength and conditioning. And what she also educated me was that I was injured because my body was not strong enough to handle the training load. So during the rehab session, she and the sports trainer pushed me really hard. The sessions were so tough. I would walk to the physiotherapy center, and after the session, I'll be limping my way back. And it was tough because the exercises were very focused on what we wanted to achieve, which was strengthening. But this tough exercise therapy sessions were actually worth it because it helped me recover much faster. My physio also inspired me to treat the patient according to the demands of the sport. If you're a rugby player, being pain-free is not enough. The physio needs to train the injured player to be tougher than before. The player needs to be tougher than before so that he can cope with the demands of being a rugby player.
Yeah, absolutely. You said you were running before. What kind of distances were you doing?
I was doing cross country. So you would always imagine a cross country runner being lean, rather skinny, being able to run long distances. But it was my physio who actually educated me that, even though training your endurance was important, but there was some, you have to have your strength base, you have to have your ability to move well in the first place. And we figured that was probably the reason why I got injured. Too much training load with too little strength base. So that was what we worked on.
Okay, are you still running now?
Running recreationally, not competitively.
I'm with you. I went for just even a little sprint yesterday and I just had to lie on the floor after on a yoga mat. Yeah, especially if you have kids, kids is going to make it very difficult, of course, to running as well. But
That's right. That's right.
Okay, so of course, you had this kind of impact on yourself, affecting your knees. But I understand some of your colleagues also work with a range of other conditions too, such as like cancer and cardiovascular and respiratory issues. Can you tell me a bit more about that?
Yeah, so I think the public's perception of physiotherapy is mainly to deal with muscles, bones, and joints. But similarly, when I was at that point inspired by my physio, I was drawn to that aspect. And because it was so glamorous, right, to work with sports athletes and all that. But very soon after I entered physio school, I realized that physios treat more than just sports injuries. There is physio for the brain, meaning physio for people working with stroke and Parkinson's disease. There's physio for the heart that involves working with patients after a heart attack or heart surgery to get the heart stronger. So for myself, I'm also specializing with, so besides working with sports injuries, I myself also provide physiotherapy for people dealing with cancer. I have colleagues within my team who deals with people having stroke, people who are handling patients with Parkinson's disease or heart attack, diabetes, chronic disease.
Okay, so I mean, I personally, I've actually met with some of the physiotherapists that work with the Singapore National Association for Strokes. So I understand for them, especially because I have friends that do this back at home, where they have certain movements they have to do, especially if someone has lost, say, the movement, especially in the legs or in the arms. So as an example, you mentioned cancer. What might you be doing with someone, of course, depending on the type of cancer they have, but what would be the kind of exercise or movements or protocols you would have for somebody who has cancer?
Yeah, so it could be due to cancer itself, causing the person to be physically weaker. It could also be due to the cancer treatment and the side effects of the cancer treatment. So let's talk about cancer treatment first. So usually the first line or the mainstream, the most, one of the most common types of treatment you will hear would be surgery. Say for example, for somebody with breast cancer, what the surgeon may do would be to remove the cancer cells from the body. So after surgery, the client, because the surgery area is pretty close to the shoulder, so the client may experience certain limitations in the shoulder. Very early on, physios are brought in to actually educate the client on how to move safely, how much elevation should we try to target, and what is the restriction that we should try to maintain during the early post-operation period. So that part is regarding improving the range of motion within the shoulder. Another aspect of breast cancer surgery could also involve the removal of lymph nodes. So when lymph nodes are removed, that also typically or potentially can cause swelling around the area, because lymph nodes get rid of some of the fluids that accumulate within the body. So when there is swelling, we also try to manage in terms of getting rid of the swelling. We want to first work on a more preventive basis, trying to prevent loss of range of motion, prevent swelling, prevent pain, and that is just the surgery aspect. When we talk about radiation therapy, you heard about radiotherapy. Say for example, radiotherapy for the shoulder. You can imagine by radiating the muscle fibers, some of these muscle fibers can become fibrotic, meaning hardening. And when it hardens, it becomes harder to move. So this is when the shoulder, the physio can work on the shoulder to get the shoulder moving again. Other than the shoulder, we may also work on the shoulder blade muscles. We may start to work on the neck muscles that get affected due to such shoulder issues. Then finally, we come to chemotherapy. So one of the most common side effects of chemotherapy is nauseous, vomiting, fatigue, general lack of strength in the body. So research has shown, especially for breast cancer, especially for prostate cancer, if they perform aerobic exercises, it can actually improve their symptoms of fatigue. It can actually improve their overall physical fitness. And that leads to greater survivability. That also leads to greater outcomes after cancer treatment.
Okay, so I know you mentioned, of course, breast cancer and how that can have a big effect on the shoulders. And of course, there's, chemotherapy and radiotherapy can affect a general range of cancers. Would you say there's any particular other types or body areas that get affected by cancer that you would see more or your colleagues would see?
Yeah, so another area would be prostate. So when there is cancer to the prostate and the person undergoes treatment, one of the common side effects would be incontinence as a result of the treatment. So that will that is involving physiotherapy for this condition will involving um, helping the muscles to regain some of this control to try to stop the incontinence issue from carrying on. Um, Other areas in general, if we talk about perhaps like bone tumor, sometimes or tumors in the muscle. So this becomes closer to like an orthopedic surgery, what we call oncological. Uh, uh, let me just have a drink.
That's okay. I'll have some coffee as well. It's okay.
Yeah. So by removing the tumor, some of the muscle tissues are also removed at the same time. And then at the same time, we also want to perform movements in a more smooth manner. So we aim to regain range of motion, aim to regain the strength. So in general, when we talk about oncology rehab, doesn't matter which part of the body undergoes the treatment, as long as your function is compromised, a physiotherapy will be able to help you. What functions do we talk about? Strength, stamina, range of motion, it could be balance, and several other issues.
Okay. So I have curiosity. I mean, you mentioned, even the glamour that can come with working with, athletes and doing physiotherapy with them. What drew you more towards this side of working with cancer patients? Because I mean, emotionally, that can be quite hard and quite heavy.
Sorry, the second part of what were
I
you
was, I was,
saying?
I was just saying it can be quite a hard and heavy work to do. But what drew you more towards then working with cancer rather than the glitz and the glamour of working with athletes?
That's right. So what is interesting in my career is that I have experienced the glamour of working with athletes. So that was my time in the Football Association of Singapore. I'm working with the National Football Academy. So it felt glamorous at that time. So we're working with youths involved in sports. We go through the adrenaline of sports. We, are highly pumped and motivated to work with athletes um, of that age group and of that motivation level. And then the career has also taken me through a wide range of different types of clients. So we are from being very active to people dealing with, almost life-threatening conditions. And the motivations of being able to live a more fulfilling life, even though the person may have a life-threatening condition. For us as physiotherapists, we actually aim to help them to achieve the lifestyle that they desire in accordance to what they should be able to achieve according to their medical condition. So if we know that this client is battling a certain type of cancer and the goal is to return back to work, we will want to understand what are the job demands of this person, and we will tailor the rehab according to that demand. Nothing too overexerting, but still intensive enough to see improvement. One of the struggles that we have as therapists is sometimes when we deal with patients who are sick, we tend to undertreat. We tend to handhold them, we tend to shower them with a lot of love, but sometimes our treatment may not be intensive enough to see a sustained improvement. So it's always a challenge as a physio to find a balance to see what is the most appropriate dose of exercise, what is the most appropriate advice for them at this stage of their condition to actually continue to improve.
I mean, I completely agree. I've talked about this many times with my colleagues. In some ways, much like say a medication, if you take malaria medication, they give you way more than you need, but it's to make sure that it's always effective because everyone's different. People will react to different levels. I did the same as a chiropractor. You have to say to some people, this is what it could take. We hope it won't, but we'll plan this just in case. You kind of have to always be prepared for that. So of course, the main things you're seeing at the moment are kind of cancer and musculoskeletal. Would you say there's more of a split, or are you more veering more in one direction or the other?
I think in the private physiotherapy setting, the main client load is still going to be sports injuries is still going to be orthopedic. Cancer is one area of specialization that I have. And what I wish for the profession and also for a lot of our private clinics in Singapore is that our therapists are getting more in tune with dealing with patients with chronic diseases, including cancer. So we're talking about typically the sports physios getting more interested and getting themselves educated on how to manage people with cancer. And when that can happen, we have actually a larger workforce of physios who are able to treat a wider range of conditions. One of the struggles I have in the industry or with healthcare in general within Singapore is that a lot of clients and even a lot of doctors, they are not aware of where they can get suitable treatment for their cancer patients, where they can achieve or who they can approach to provide oncology physiotherapy to get their clients better. So we need to also try to, so I actually spend quite a lot of time doing public talks, doing online trainings to educate the public on the importance of being physically active to prevent cancer, to prevent chronic disease. On the other hand, when chronic disease happen, when cancer happen, there are solutions for you. So one of the goals I have for my practice is also to actually educate the public, encourage fellow professionals to be in tune and eventually train themselves up to be able to handle such a client base. And eventually, to answer your question, from a high number of orthopedic patients and a small number of cancer patients, we can actually increase the number of patients load in the cancer category so that we can better meet those needs.
Okay. So of course you mentioned some challenges there among, of course, maybe not some people are being as aware of what they can do. What would you say are some of the challenges that you have had of starting in this profession? So kind of, we're backtracking a little bit, but what would you say are some of the challenges you've had?
Yeah, so in terms of challenges would be getting the public to shift towards having a more proactive approach to injuries and illnesses. So traditionally, medicine has evolved over the centuries to become, so traditionally people, when they have chronic diseases, they see a doctor and they get prescribed medications, they get prescribed, a whole list of drugs that they have to take in order to manage. But it's also time to start to consider being active, taking an active approach. We're talking about regular exercises, we're talking about active lifestyle, we're talking about proper diet. So when all these come into place, chronic disease can be prevented. So I think that would be one of the biggest challenges, is to shift the public mindset from a more reactive approach to be more proactive. And our role as a chiropractor, as a physiotherapy, our role is to educate the general public to take a more proactive approach to prevent disease in the first place.
Yeah, absolutely. I mean, I have nothing against medical doctors and allopathy. It's very, very useful. If I get hit by a car, do not take me to my physio or my chiropractor. Please take me to the hospital. But it has to be that kind of step to and fro. As well as physiotherapy and chiropractic, what other things do you think, or other professionals do you think cancer patients should talk to or consult with?
So with my experience with cancer patients, one of the greatest issue is that they have a loss of appetite. So together with the disease, they have, a general loss of strength, loss of appetite, and with lesser intake, there's also lesser fuel for the body to move. So if as a physio, our main treatment is to get them to exercise, to move more, then we also have to complement it with nutritional advice, proper nutrition guidance, also, the safety aspects of handling food. People with compromised immune system shouldn't be having raw food. And so how do we prepare food in a way that it is safe? We also would also want to consider active lifestyle approaches. including getting some fitness instructors involved to get the clients to exercise in their preferred mode of exercise, because medicine or healthcare in modern times is about personalization. So if today I'm somebody interested in yoga and I am battling a chronic disease and my preferred mode of treatment is yoga, then we will also try to refer on to somebody who is in tune with yoga and chronic diseases. If somebody is interested in dance, dance would be a very excellent physical activity to have in their daily routine. So different strokes for different folks.
Absolutely. I've always said the same when patients ask, oh, is there any particular exercise I should do? And it's like, I give you 1,000 exercises, but if you don't enjoy them, you won't do them.
Yeah, that's right.
The most effective one is always the one that, it's not always the difference between good is better than, sorry, done is better than perfect. So it's the same for the exercise. It may not be necessarily the best exercise, but if it gets people moving and healthier, then it always is of benefit.
That's right.
So you mentioned before about, of course, speaking publicly. I know at the moment you're doing seminars online, and of course, being quite busy with your patients. What do you think are some of the most important factors for your own personal success?
I'm always very grateful for the opportunity to speak publicly and to engage the public in topics that are close to my heart. And I think it is made possible due to perhaps the collaborative mindset of the people that I work with and also myself. And when we have different professionals like you and I speaking on a common topic and offering our own perspective to address the same topic, we're giving the public more options to consider. We're also getting the public general awareness level higher, and people want to have choices and people want to know what are the treatment options available for them. So when we present treatment options to them, they can make an educated choice as to which treatment approach they want to address their situation, their physical conditions. So public talks is one area that I focus in this year. Unfortunately, with the COVID situation, a lot of these talks have to be shifted online. I'm very fortunate to still be able to do it in the comfort of my own home. In fact, this morning, before I came online for this interview, I was involved in another health talk to a group of business owners, sharing some of the insights to help them manage, continue to be effective in their work, even though they are working from home.
Okay. I think that's quite useful. I'll have to check that out as well. At the moment, my house looks like a bit of a WeWork or a public working space at the moment. We've got lots and lots of screens and lots of people. Okay. You mentioned before about some goals you have for the profession at the moment. What do you think needs to be done to achieve those goals in terms of changing people's mindset? And also you talked about, integration in healthcare and I guess at some level even MOH government changes as well.
Yeah, so with the COVID situation, a lot of health professionals have been affected, and we understand that several of us, we feel strongly that we are essential service, and I believe that actually the government and the public agrees that we are essential service. Unfortunately, at this time, the public health safety is of more importance. So we could understand that some of our services have to be postponed until the public health issues are settled. But it has also become very obvious for us as health professionals, whether we are nutritionists, dietitians, physios, chiros, that as a government, as an association, as a professional body, we need to be stronger, we need to be more united, so that when the COVID situation is over, or even if the stay home advice is to be extended, we continue to campaign for the profession, and we continue to be advocates for our patients. So we're talking about sending a public message across, telling them that, yes, even though you are asked to stay at home, yes, even though public spaces are closed off, you can't exercise outside, you can actually take an active approach to your health. As a profession for physio, we need to work more on a public health level, getting the public to be more aware of what we do. Similarly, for chiropractors, need to get the public more aware about what chiropractors do to contribute to their health. It's the same thing for, perhaps health coaches, for dietitians, nutritionists, working with your associations, being strong as an association, being strong as a profession so that the message is consistent. The last thing we want is, during this stay-home period, to have one black sheep in our profession to be doing something wrong, to be, continuing to see unnecessary cases in their clinics, jeopardizing the reputation of the profession. So my message is to stay united with your association, to look at the greater purpose, to work towards the common good. And that is, to advocate for our clients, for our patients.
I know for us, we have essentially two associations within Singapore. The bigger one, which is I'm personally a part of, and I'm a chair for one of the committees, Alliance Chiropractic. We get messages all the time, especially from the president and from other members of the board. So it's very, very helpful. For physiotherapy, do you have one particular board, or are there two boards? How does it work?
Yes. So during this period, we are very grateful to have the Singapore Physiotherapy Association helping out not just the public sector physio, but very, very focused on our our private practitioners out there. And they have provided a lot of advice and guidance as to how we can overcome this situation. And they have been our voice to government bodies to continue to communicate our concerns and address our needs. So many thanks to the Singapore Physiotherapy Association. On the other hand, physiotherapies are also regulated by the Allied Health Professions Council in Singapore. So they are part of the Ministry of Health, and they have been regulating the profession and also safeguarding the public interest. So these two are the main bodies that that physios work with on a higher level.
Okay. So as well as the goals you have for the profession and healthcare in general, I think that's a big goal. Always good to have. What are some goals you have for, say, your own particular practice? I know you changed location. I think it was last year as well.
Yeah. So as a practice, as a profession, personally, I hope to see more collaborations. Very often, professions, we work in silos because, I think even us physios, we are guilty of saying that we can handle all conditions. But whenever appropriate, if we have trusted partners that we can refer to, I would tend to refer on rather than taking everything to myself. Of course, it's true that physios, we can learn more about nutrition. Physios, we can learn more about one aspect or the other. But when we have a client who have needs and they trust us, they trust our recommendation, we will also want to refer to the subject matter experts as well. For example, for physiotherapists, we are already starting to work very closely with mental health professionals, especially in the area of chronic pain management. So typically, when we handle a client where we realize that the source of the pain is no longer related to the muscles, joints, and bones, that we suspect that this pain may be a little bit more psychological, or there may be more social reasons to this pain, we may refer them on to our mental health professionals, such as psychologists and counselors. So we need to see more and more such collaborations going on. In the area of chronic disease management, if we are handling the physical aspects, could we also engage our nutritionists, our dietitians to help them with the nutrition aspect? Another area very close to my heart is increasing the public's awareness about exercising for general health and for prevention purpose. So I see a role for physios in working closely together with general fitness instructors so that clients can get more varied types of exercises clients or the fitness instructors, they will be more in tune with the medical knowledge that physios know about health conditions, so that in turn, fitness instructors also increase their knowledge base to be able to treat their clients more effectively.
Okay. I mean, I completely agree. It's something I talk about with my colleagues all the time, that even for conditions, trying to necessarily help everyone, you can end up not helping that many people at all. It's always good to have people to refer to. It's like if you go to the dentist and he starts telling you about your accounting options, like, yeah, I mean, you might know stuff, but probably good to go to an accountant. Kind of the same thing for us as well.
That's right.
So given the current lockdown that we are, or not lockdown, but the circuit breaker we're experiencing within Singapore, what are some tips or some advice you would give to people who are spending more time at home and maybe not in the best positions or postures?
That's right. So in this lockdown situation, everyone is homebound. We are encouraged to keep everything indoors. So if there is only one advice that I will give, it is to stay active. Find the things that you have in your house to stay active. So take, for example, if you are somebody who is very used to exercising outdoors or even going to the gym, you are going to struggle with staying at home. So instead of looking for gym equipments, actually I understand that a lot of the gym equipments like dumbbells, they are already sold out. So instead of frantically looking online to buy equipment, look for ways to exercise using your own body weight. There are several furniture that you can work with to exercise. So stay active, choose your preferred mode of exercise, because the best exercise is the exercise that you actually do, right? So if you are interested in Pilates, go online to search for free Pilates workout, or even there are some very highly customizable paid workouts that you can choose online. So this morning I had the opportunity to share with some business owners some tips on staying active during the lockdown period. I would say, in general, try not to sit more than 20 minutes each time. Get up, drink plenty of water. If you drink more, naturally you will go to toilet more often. So that is already, breaking the monotony of being in the same place. Be active. That would be my greatest advice for this situation.
Okay. And just before we go today, going a little bit more personal, if you could speak to yourself, say 5 years ago, what advice would you give to yourself?
So I've been a physiotherapist for 11 years, and my most rewarding periods have been the first perhaps 6 years, 7 years when I was working in the government restructured hospitals. That was when I gathered a lot of experience in the areas of healthcare, seeing a wide range of conditions from stroke, Parkinson's, heart disease, joint pain, neck pain, back pain. So this period was, a period of learning for me. Subsequently, I went over to the private sector and also even started my own business. To answer your question, what advice would I give myself 5 years ago? I would have loved to come out to start my own business earlier. So right now, my business has been running for 2 years already. And when I came out, I saw that there was a lot more opportunities outside. So even though my first 5-6 years have been the most, in terms of growth, what I've learned the most, subsequent time in the private sector has actually opened my eyes to more business opportunities. It has also opened my eyes to more the need to get the public more aware of the profession, the public to be more aware of health and wellness in general. So I would actually start my own business earlier, focus a lot on engaging the public to be more active, to actually take control of their health.
Okay. I think that's a great message. It's a great message for everyone. So I just want to say thank you, Jaden, for joining me today, and for everyone who's watching, either live or on the replay. If you have any questions, you can always contact me via 84389550. You can email help@vitalitychiropracticcentres.com, or of course you can put messages into the comments. I'll make sure that I reply to them as soon as I can. I'll also make sure, of course, I tag Jaden and tag his practice in here, so that if anyone has any questions, they want to know more about what he's doing, of course you can find them all through there. Okay, thank you again, Jaden.
Thank you for having me, Dr. Shaan. Thank you.
It's very nice to have you. Okay, everyone, stay safe and have a great day. Okay, so we should be off now. I think the live should be finished.
Okay, great.
Okay, yeah, have a great day, man.
Thank you. Thank you.
Okay, see you.
So I'll catch up with you again.
Yeah, absolutely.
Okay, see you.